Medical tests are very useful. They can help doctors diagnose which patients have a condition and which patients do not. However, some tests are more useful than others in doing this. In order to identify which ones are more useful, we rely on statistics. Let's say I invent a brand new pregnancy test that only costs $1, where you spit in a container and get the results immediately. Of course, before selling it, I'd want to check the statistics to make sure it works. The first statistic I want to discuss is called sensitivity. Let's read the definition. If someone has a condition, then what are the chances of the test identifying them as having the condition? Now for a visual demonstration. These 16 faces represent pregnant women. This box represents the test's positive category. In other words, saying the individual is pregnant. This box represents the test's negative category. In other words, the individual is not pregnant. In this scenario, the sensitivity would be 100% because the test correctly placed all 16 of the 16 pregnant women in the pregnant category. Okay, what about another case? In this scenario, the sensitivity would be 87.5% because the test correctly placed 14 of the 16 pregnant women in the pregnant category. These two individuals in the not pregnant category are what are referred to as false negatives, because they received a negative result which is false. Okay, what about another case? In this scenario, the sensitivity would be 50% because the test correctly placed 8 of the 16 pregnant women in the pregnant category. That means the other 50% were incorrectly placed in the not pregnant category. Now let's move on to the second statistic, specificity. If someone does not have a condition, then what are the chances of the test identifying them as not having the condition? Now for a visual demonstration. For our example, if someone is not pregnant, what are the chances of my test saying they're not pregnant? These 16 faces represent non-pregnant women. Once more, this box represents the test's positive category. In other words, saying the individual is pregnant. This box is the test's negative category. In other words, saying the individual is not pregnant. In this scenario, the specificity would be 100% because the test correctly placed all 16 of the 16 non-pregnant women in the not pregnant category. Okay, what about another case? In this scenario, the specificity would be 75% because the test correctly placed 12 of the 16 non-pregnant women in the not pregnant category. These 4 individuals are what are referred to as false positives because they received a positive result which is false. Okay, what about another? In this scenario, the specificity would be 25% because the test correctly placed 4 of the 16 non-pregnant women in the not pregnant category. Alright, now let's do this for both pregnant and non-pregnant women. This scenario would be the best test result, where all the pregnant women are in the positive test category and all the non-pregnant women are in the negative test category. Okay, what about another? Let's talk about this. A sensitivity of 100% means that 100% of pregnant women were told they were pregnant. A specificity of 87.5% means that 87.5% of non-pregnant women were told they were not pregnant. In other words, 12.5% of non-pregnant women were incorrectly told they were pregnant. If a friend of yours took my new pregnancy test and the test said they were negative and they asked you if it's reliable, what should you tell them? You would say yes, because since the sensitivity is 100%, 100% of pregnant women are in the pregnant category. That means only non-pregnant women are in the not pregnant category. But what if the test told them they were positive? What should you tell them? You could say, well, since the specificity is 87.5%, that must mean 12.5% of non-pregnant women were in the pregnant category, so a positive result from this test is not reliable. Okay, let's do a different example. Let's say we know the statistics of a test, which are written up here. What does the sensitivity of 100% look like? It means 100% of the people with the condition who are pregnant are in the positive test result category. Now, what does the specificity of 75% look like? It means 75% of people without the condition who are not pregnant are in the negative test result category. And unfortunately, that means the remaining 25% of them are in the positive test results category. Let's talk more about this scenario. We see that with a sensitivity of 100%, 100% of pregnant women are correctly placed in the pregnant category. This leaves 0% of pregnant women in the not pregnant category. Therefore, this test is still reliable for when the result is negative. But unfortunately, the test is not reliable for when the test result is positive. Okay, what about another? Let's talk about this. A specificity of 100% means that 100% of people without the condition are placed in the without the condition category. This also means that 0% of non-pregnant women are in the pregnant category. Next, a sensitivity of 62.5% means that 62.5% of pregnant women were placed in the pregnant category. That must mean the remaining 37.5% of pregnant women were incorrectly placed in the not pregnant category. So if a friend took my new pregnancy test and the test said they were positive and they asked you if it's reliable, what would you tell them? You would say yes, because 100% of non-pregnant women were told they were not pregnant, meaning only pregnant women received positive results. But what if the test told them they were negative? Then what would you tell them? You could say, well, since the sensitivity is 62.5%, that must mean 37.5% of pregnant women were told they were not pregnant. So a negative result from this test is not reliable. 2 more demonstrations and we're done. First, I want to show how the placement of people without the condition does not affect sensitivity. We see here that where the non-pregnant women are categorized has no influence on a test sensitivity. Second, I want to show how the placement of people with the condition does not affect specificity. We see here that where the pregnant women are categorized has no influence on a test specificity. This finishes the video. Thank you for watching. Comment below on which topics you are interested in learning more about. Also, leave any feedback on how these videos can better serve you.